Hello everyone, thanks for tuning in to another episode of Psychologists. Yes, I know, it's consistent Abdi. I told you, consistent Abdi is going to be consistent with these videos. You just watch, okay? That's what, 3 or 4 videos right now, so you know what I mean. But for those that are new here, hello, my name is Abdi. I'm a trainee health psychologist, currently completing my doctorate in health psychology. But I already know what you're thinking. I know exactly what you're thinking. What the hell's a health psychologist? What you guys do? Isn't that the same as clinical? And I'm gonna explain all, don't worry, because in this video, I'm gonna be talking about what health psychologists actually do. I'm also going to talk about things that I've done whilst I've been on training, and also I'm going to be talking about whether or not there are opportunities for health psychologists within the NHS. But before we get into the video, I've got a little announcement. 70% of you are not subscribed to the Psychologists YouTube channel. So to rectify that, I'm going to sit here sipping my tea whilst you subscribe. Have you subscribed yet? Yep. Yeah, okay, you've subscribed. So let's get into the video. So, you probably think, whoa. I know what you did there. You think you can hustle me? I know you didn't subscribe. What are you doing? You think I wouldn't know this? All right, I'll give you another 2 seconds. Go subscribe. Go on. You done it? You done it for real now? Okay, there we go. So, you're probably thinking, what do health psychologists actually do? You've probably never heard of a health psychologist. You probably don't even know where they would work. And there's good reason for that. Previously, health psychologists were mainly based in research labs and, universities and things like that, doing solely research. Since probably about 5-6 years ago, more and more health psychologists started to come out and started to go into more practical settings like the NHS and things like that. And we started taking up roles within clinical health psychology teams. And for those that don't know, there are loads of those types of departments, clinical health psychology departments all over the UK. There's one in Manchester, there's like 2 or 3 in the Midlands, there's loads in London. So there's loads of these different clinical health psychology departments, which previously was exclusively for clinical psychologists. But now that health psychologists are starting to come out more, we're starting to now take up these roles and be more of a presence within the NHS. But what do we do? And the answer to that is largely what clinical psychologists do, or counseling psychologists or forensic psychologists. We have the same core competencies as the other types of psychologists. So things like assessment, formulation, seeing patients for therapeutic intervention, leadership, teaching, all these things that you would expect from a different type of psychologist, like a clinical psychologist or a counseling psychologist. But all we do is we focus around the area of health. How does mental health affect someone's physical health? I'll give you an example of the things that I used to do whilst on training. So what I used to do is I used to have a caseload of about 6 patients. And within that caseload, I was supporting patients on things like health anxieties, pain management, weight management. I used to see a patient that he was so scared and so afraid against going to the dentist that he had a toothache. And yes, I'm about to say this. He had a toothache for 7 whole years. Imagine having a toothache for 7 years. And this is the situation that he was in before I started to work with him and start to unpack some of those fears and all those anxieties that he had around going to the dentist, to the point where he was able to then go to the dentist and have those teeth extracted, which was amazing. It was an amazing experience for me as a clinician, but also for him to no longer be in pain. I used to see another patient that had really bad health anxiety. I'm talking that if he didn't have a specific type of injection every 3 months, he would believe, and he truly believed this, he believed that he would die. So before getting to that kind of 3-month appointment, his anxieties would be through the roof. Any type of physical kind of difficulty, he would automatically assume that he's gonna die and that's it. And he would catastrophize it. So I came in and I was supporting him with his health anxiety, and actually a very kind of CBT approach of how to support him with those anxieties. And I'm not gonna lie to you, 4 or 5 years ago, I didn't even know what a health psychologist was. And I didn't even know that, health psychologists do all of these things. But as I was getting further and further along in my career, and the reason why I chose to do health psychology is because a lot of the things that I'm doing now are the things that I wanted to do as a clinical psychologist or a counseling psychologist. So when I heard about health psychology and health psychologists, I was like, this is exactly what I want to do. I'm just gonna go down this route. So those are the type of things that I used to do on a regular basis. Also, I know what you're probably thinking. What? This just sounds like a clinical psychologist, but in a more physical health kind of setting. And you'd be right. There are a lot of similarities between clinical psychology and health psychology. There's a lot of overlap. I am planning on doing another video on the similarities and the differences between clinical psychology and health psychology. So be sure to watch that when it comes out. Also, another side note, when psychologists get onto the doctorate and they complete complete their doctorate and they go for the HCPC registration, which is the governing body that governs all types of psychologists within the UK, they are registered as an applied psychologist. So regardless if you're a health psychologist, counseling psychologist, clinical, educational, forensic, whatever type of professional doctorate that you do, in the eyes of HCPC, which is the Healthcare Professional Council, you are an applied psychologist. So really, there's not a lot of difference between all the different types of psychologists. And another reason why I always say to psychology graduates to pursue what they actually want to do and what their passion is, rather than thinking what everyone else is doing. Because at the end of the road, everyone gets the same qualifications, everyone gets the same kind of powers and things like that. So the next thing that you're probably thinking is, but Abdi, I've never seen any health psychologist roles available. You know, I've never seen these roles. How can you tell me that it's an exciting area when I don't see any job roles posted? Like, what are you talking about? And I'll explain that. Back when I started my career back in like 2014, I was looking on NHS jobs for qualified psychologist roles. You know, I was an undergraduate thinking that I was a fully qualified psychologist, and those were the type of jobs that I could go for. I noticed that a lot of job adverts were advertising for clinical psychologists and nothing else. But as time has gone on, what I have noticed is a lot more health psychologist roles coming up. You know, I see loads of job adverts right now that say they're looking for a clinical stroke counseling stroke health psychologist. It's not just exclusively for clinical psychologists. And what I see in the next couple of years is that more people are going to clock onto there's different types of psychologists. Previously, there were a lot of roles that would be better suited for, let's say, a forensic psychologist or a counseling psychologist, but it would be advertised as a clinical psychologist. But what I'm seeing now is I'm seeing the opposite. I'm seeing that people are starting to wake up to, well, hang on a second, no, we need a forensic psychologist. No, we need a counseling psychologist for this role. And it's good for the profession in general because people are understanding psychologists better, which is a positive for everyone. So in terms of opportunities, there are loads of opportunities for health psychologists now, and it's only going to get better as the years go on. So that is it, guys. That is the end of the video. Hopefully you learned a thing or two about what health psychologists actually do, and you never know, if this is something that you're interested in, do your research. If health psychology is what you want to do, go for it. There's so many opportunities and there's so many ways that you can actually fund doing your health psychology doctorate. Thank you guys for watching this video. Can you do me a massive favor? Please click that subscribe button. We are on the road to 10,000 subscribers, so please click that subscribe button for me. Can you also do me another favor and follow all of our social medias at the bottom here? We actually post on our Instagram regularly, and a lot of people have called us the most relatable psychology page ever on Instagram. Thanks for watching, Psychologists. Like if you're liking this, and I'll see you next time.
4.5 in the bando, cover that shit in plastic. Heading outside to the Batmobile, look like a rub-bent athlete. If I see that up boy dashing, I ain't gonna stop for traffic. If I let that bando down, how you gonna mix that magic? Bro, he's telling me, yo, Sway got plenty bad habits. Still delivering grams, I'm stashing them peas in the bedroom mattress, digging up burgers, testing out skanks for practice. These feds can't